Hello and Namaskar. Myself, Dr. Jitendra Kumar, academic member of the NLC, and today we have the legendary faculty Dr. Ashish sir and Dr. Himanshu, or the topper of the FMG recent FMG exam. And today we will discuss the important concept and the topic, which is the how to use the MCQs and what is the importance of the MCQs and how to solve it, sir. Ashish sir.
150. I think that is the only thing I will say about the importance. The moment you say 150, this 150 is what? Is marks, but they are in the form of MCQs. Each MCQ is your make or break. Ask someone who's getting 149. For him, this is not a one MCQ. It's like a question of life and death. So I think for a student, not just FMGs, NEET PG, super specialty, we all are dependent on the MCQs. Our life might not give us multiple choices, but at least examiner is giving us choices, and we have to choose the right one, and that is what the importance is.
How much you solved the per day MCQ during your preparation days?
The average was minimum 50, which I used to do every day, because it's like the satisfactory thing for me to do every day. And like before going to bed, I have that habit that minimum I will solve 50 MCQ, then I will go to bed.
Okay. And what is the correct method to you solve the MCQs?
I think first thing is directly solving a question is a very reckless step. You should always be prepared. Like if you are facing a fast bowler like Jasprit Bumrah or Pat Cummins, will you go without helmet, gloves, pad?
No, sir.
Same way, if you go to approach a question without any theory and you say ki I will learn from the question, it is very stupid things. Okay, you cannot learn from question if your mind is blank. So first request is have a good conceptual understanding of the subject. That's the first thing. Number two, when you're solving the question, always keep an empty notebook with you. And whenever you find any question you are getting it wrong, please write the answer or at least one line. Ki this I got wrong because of this particular phenomena. And number three is when you solve the question, also try to find why the other three options are not. I've seen lots of people solving question A, done. Why A? Why not B? I have gut feeling. This gut feeling could be potty also, please. So get rid of this gut feeling. We all have this gut feeling. So please don't rely blindly on gut feeling.
And how much MCQs in the last days of papers, like 1 month left, how much MCQs and what source would be the helpful?
And like when we are coming near to the exam, I thought that my syllabus is complete. Now I have to go the retrospective manner. Okay. Now then I started doing 100 MCQ per day, and these MCQs were based on the like the weightage of the subject. Like if I am doing the ENT, then like the ENT is the high yield, ophtha is high yield, pathomicro is high yield. Then I will do first 100 MCQ of this subject, and the sources was like the NLC questions, NLC Q bank, and the book which Team NLC gave us in the very first beginning. It was the like the image marathon also like that. And after doing this, I went for the like doing custom modules
on the things. Okay.
on different things.
You saw this that
Yes.
pattern is changing the NB pattern.
Yes.
The clinical and the integration of the subjects, as you started very earlier, the integration of the all subjects, how to approach the things of the clinical management and everything.
See, the first thing is remember the examiner is now no longer interested in just getting you to reach the answer like this. He actually wants you to read the question, make your own hypothesis, ki what this disease could be, what the patient might be suffering from. So that means you should have a clear picture. And then when you read the option, you will be able to get the question correct better. So I told you already, without theory, don't do it. Number two, not just read the theory, try to understand what the disease actually means. Most people, what they do is they just want to get the answer, remember the answer, and want the same topic, same thing to come again. But the examiner will keep asking you new version. It's like you learn 2 into 2 is a 4, and you want the examiner to ask you exact 2 into 2 4. If he give 2 into 3, you say, hey, what is this? I was taught only 2 into 2. The teachers are bad, all the apps are bad, everything. Arey Baba, 2 into 2 4 hai. So you should understand 2 into 2 means add 2 2 times. 2 into 3 means add 2 3
Three
times.
times.
So concept should be clear. That should be the answer 6. So that's why my request is, please, if you have time, go for concept. If less time is available, then do the important topic conceptually.
Yeah.
Clear? Rather than skipping the subject. Some people don't do physiology. That is very common. Are physio, how many questions come? But point is, physio, patho, pharma help you indirectly. That's why the integration occur at the level of medicine. Someone reading medicine without them is making a mistake. So my request is, please go in a sequence to physio, patho, pharma, do the medicine, and then do your question. The questions will be solvable, and you will be confident that you are going to get very good score in the exam.
What is the sir major reason to buy the NLC test series and Q bank?
I think the major reason is it is very, very student friendly. Plus, it is not a rigid fixed structure. It keep evolving. Like when I realized that NEET PGs are now becoming a very major source of the questions in FMG since 2022, I actively started giving. We are the only FMG Q bank, or you can say institute, which started practicing NEET PG since 2022 itself.
Also, INICET.
Yes. Then last year we added INSET. Why? Because now NEET PG, some of the questions are changing with INICT. So I think they are having some evolving strategy where they both are trying to converge to the next pattern where the clinical pattern is taking preeminence. And then we started doing that, and you won't believe the results.
Yes.
Our students who were able to pass here, they all passed with very good score in the recent exam. And the ones who are using our Q bank, they gave a honest review ki sir, whatever questions we got in our GTs, mock tests, almost similar questions were there. How is it possible? I said it's just because once you know the pattern, like how Jasprit Bumrah became the best fast bowler. The answer is not because he lie on the pitch. He lie on his skills. So he's not pitch dependent. There are some students who are like exam dependent. Easy question आएगा, easy paper आएगा. Sir, June का tough होता है. अरे बाबा, it should be you who should be tougher than the exam pattern.
Did you find anything that we are changing according to changing the questions and the pattern? We update our Q bank, not like the 2017 or the 15 it's old.
Yes.
Did you find something like we are changing and it's a new?
Like which I found most useful was like the explanation was not too vast. Like it's becoming your main notes.
That's true. That's true.
And the second one is like the NEET PG questions were to the point. Because I saw that the NEET PG questions really help a lot in the main exam, because the exam the language which is designed in the app or in the test series are the much similar to the like the questions was too similar for the like which came in the exam also. And the options the question doesn't become hard based on the questions only. It become hard based on the options. Like the options are lengthy, then if the question itself is easy, but if the option is lengthy, then the student may not able to read all the options correct, and like in the hurry he will do mistake. So in the Q bank, the options were like there were questions which are lengthy also, there were questions which are moderate level also, and there were questions which were like the one liner also. So it was all the balanced.
The balance mix of the all things.
That's true.
That's why this is our main the reason why people choose the NLC test series and Q bank. This is the main reason, because we are the like 15-14 peoples of the academic team. We are working for this, and we filter from the faculties and the whole send them. Then we submit the all MCQs.
Yes.
So we finish. Thank you, sir, and thank you, Dr. Himanshu.
Thank you.
And
best wishes to all the students.
Yes.
And we'll just give one message. Okay, if you are watching us, listening to us, please be sincere, be serious, and trust your preparation. Try to solve as many questions as possible. We recommend at least 100 questions per day towards the end. In the beginning, 50 is sufficient, but increase the number of questions and try to write the explanation of the wrong questions which you're getting. Because I'll tell you, sometimes 20-30 marks you get extra from just learning from your mistakes. And second advice, we told you already, NEET PG, if you're not doing, then you will regret. Anyone who followed our advice, especially when I said before the exam, do NEET PG, do NEET PG, some were saying, sir, pagal ho gaye, हम क्यों करें, हम तो FMG वाले. First, you are not FMG, you are doctors. So excuse बंद करो, FMG question bank. There's no FMG question bank. There's only one question bank, that is your NB question bank. and that conduct both the exam. So please
Yes.
prepare for both kind of questions.
Okay. Thank you, sir,
Thank you,
and
sir.
see you in next video.